questions that we have given, 3 people have answered 49 correct. Then the computer G will find out how much time you took average per question, and that will determine the tiebreaker. So that we lazy people here will not have to ask a tiebreaker question. Is that clear? This keypad, the top button with the finger is only for the bathroom flush use, so don't use it. A, B, C and D are the buttons to be pressed. Whether you point the thing in my direction or in the direction of the wall or the ceiling will not make a difference. Electromagnetic radiation will travel in the same amount of time. For security reasons, we are not telling you where the server is, where this will be recorded so that you don't hack into it. So you can press it wherever you like, pointing to ceiling, pointing to floor, it will not make any difference. Just look for the red light when you press the button. There are 50 questions. There are 50 questions. 30 of them will be asked by me, and if Dr. Namrata can reach back from a hall where she's got 17 other presentations to make, then the next 20 will be asked by Dr. Namrata. So if everyone has settled down and everyone has got a voting pad, let's start with some warm-up questions for the Entod AIOS mega quiz. Then we have the first question. So the prizes are, first prize 1,50,000, second prize is 75,000, and the 5 winners will get 25,000 each, and there is 2,000 rupee prizes for 10 other winners as well. So people wearing red t-shirts are disqualified, they will not receive any prizes. So there are actually 2 quiz masters. Partha, by virtue of office, gets to put his face in every presentation by default. And the instructions which I have already told you, there will be a total of 50 questions for the quiz. Each question will have 4 answers possible, that is A, B, C or D. You have 15 seconds to answer, so wait for either the tick-tock or the visual clue. Don't press too early. Once the time lapses, the last answer will be final. If you have selected none, it will be just considered that you passed. It's okay to pass. There is no negative marking. Dr. KPS Malik, please, you can either light the lamp or you can come and sit here, whatever you want to do, come. You can come up, absolutely no problem. I have given him only 5 questions as a bonus for sitting upstairs with us. Dr. KPS Malik, past president, welcome. We'll go on to the next slide. So this is your dummy question. Which is India's fastest growing dry eye therapy brand? Aios Soothe, LOC Tears Fusion, Hyla Fusion or Lacril Ultra? And your time starts now. Somewhere something will happen for the time to start. Okay. How will we know that the time has started? Ouch. Yeah. So something as painful as that will happen, and that means that the time has started, correct? This means the time has started. And there is actually a visual clue which says 654. And Entod needs to do a lot more marketing to tell you which one is the Entod brand. So the correct answer was, it's coming, the correct answer is coming. The correct answer was option B, LOC Tears Fusion. It has to be because I am the treasurer of the LOC over here. The local organizing committee has shed a lot of tears, especially on day 1 when we didn't get to eat lunch. And it's nice to have you all fused over here for this quiz. Next question. No, you can press A, B, C or D. Which Entod pharma brand and the green numbers are telling you how much time you have left. Please come in and take your seats on the carpet. They've recently cleaned it about 2 weeks ago. Come. And the correct answer is D. I mean, 86% can't be wrong, so it must be D, I'm guessing. And the correct answer was D. Option D, phenocane plus. So we are getting better at this button pressing thing. Do we have one more, or are we having the first question? One more dummy question. For those who came in late, dummy questions are meant for you to test this device. You press either A, B, C or D. Do not press the finger button on the top. That is to mislead everyone. So just press A, B, C or D and do it in 15 seconds. First there will be an annoying sound which comes and then green numbers come up there. So do it during that green number time. And next question is, which is Entod's latest glaucoma brand launch? Row press, AB press, DO2 or T1PF? And your time starts with the green numbers. Okay. And the correct answer, 52% got that as A, so let us assume it is A, and it is A. One more important announcement is that no prizes will be given for two people sitting next to each other unless they documentarily prove that they don't know each other, they don't belong to the same institute, don't share the same surname, something like that. So husband, wife, not allowed. Same institute, two people, not allowed. Just sitting together and knowing each other, not allowed. Just pretend you don't know each other if both want to claim prizes. Okay, so we go on to the quiz. Anyone who wants to come and sit, the carpet is available. Even these seats are available. You can even sit on this. You can choose blue carpet or red carpet, whatever you want to sit on. Please come in and sit. Come and sit, because you're more relaxed when you're sitting, and when you're more relaxed, you're apt to press the wrong answers more often. Let's go on to the first question then. Everyone is ready? Everyone's got a voting pad? Okay, great. So we go on to the actual questions, and since I've forgotten the answers, I'll play the quiz with you. Let's go on. The first actual question. The first glaucoma drainage device introduced in 1969 was the Ahmed valve, the Barwelt valve, the Molteno valve, or the Kruppen-Denver or Kruppen valve. 1969 was when the first glaucoma drainage device was there, and the time starts now. Ouch. So they cleverly put Ahmed with A and Barwelt with B, and then they've just forgotten about B. And there is a tie between B and C. 36% and 35% of you thought it was either the Barwelt valve or and we'll get the correct answer. Ahmed, Barwelt, Molteno or the Kruppen. And the Molteno valve was the first one which came in way back in 1969, before about 57% of this audience was born. And the next question, golden metallic sheen of retina which disappears on dark adaptation is called the Oguchi's phenomenon, the Mizuo Nakamura phenomenon, the Miyake phenomenon, or the Kondo effect. So all four are Japanese people, incidentally. So golden metallic sheen of retina which disappears on dark adaptation. And the time starts now. 15, 14, 13 and so on. questions well, it's the golden metallic sheen which disappears. And 56% of you thought that it was B, and the correct answer was it Oguchi's or Mizuo Nakamura or Miyake or Kondo? And at some point you will reveal the answer. Yeah. I told you I have forgotten the answer, so I also need to, I wish I could have shown off and said, yeah, it is this. And the correct answer is B, which is the Mizuo Nakamura phenomenon, which happens in Oguchi's disease, but the phenomenon is known as the Mizuo Nakamura phenomenon. Next. Whose name is associated with iris nevi, eyelid twitches in myasthenia, epithelial basement membrane dystrophy, interstitial keratitis. This gentleman gives his name to a lot of other things as well. I just picked up 4 at random. Is it Kogan, Aruga, Horner or Verhoff? So this gentleman has given his name to a lot, and the time starts now. This incidentally is picked up from the Indian Journal of Ophthalmology. And the correct answer is A, Cogan's disease, absolutely right. So many of you got that right. Cogan is the chap who gave his name to Cogan's interstitial keratitis as well as EBMD and so on. We go on to the next question. Nepafenib eye drops, common eye drops which all of us are using. What is the strength of Nepafenib which is available to us in India? Is it 1%, 3%, none of the above or both of the above? Nepafenib, we are using Nepafenib for our, as an NSAID. Is it 1%, 3%, none of the above or both the above? I'm sure you don't have sample packs in your bags as of now because they're not distributing Nepafenib samples. So the correct answer, the time starts now. You need to start the time. So this is quite simple. Usually when you get something like this, the answer will be both the above. But since you can't have 1% and 3%, I would suggest you don't go for that. And unlike in dry eye where you have 0.05% and 0.1%, in Nepafenib you have only a single strength, and the correct answer was option C, none of the above. When you go back, look at your Nepafenib bottles, it's 0.1%. And we go on to the next question. The Emery liquid classification is used to grade what? Rhabdomyosarcomas, retinoblastomas, diabetic macular edemas or cataract. So when you say that I graded this with the Emery liquid classification, what are we talking about? Are we talking about some nasty tumors, or are we going back to the back of the eye for diabetes, or are we classifying cataracts? And it's a fairly common and used classification. It's not something which is not used, and most of you all went for some tumor because it sounds logical to go for a tumor, because we grade tumors so often, but it is a simple classification for cataract. So when you are grading a cataract and you want to present a paper on cataract, most people, at least 60% of all papers, grade it according to the Emery Little classification. And we go on to the next question. Still on cataract, the commonest type of pediatric cataract is a nuclear cataract, or a lamellar cataract, or a sutural cataract, or a zonular cataract. None of the above is not there, all of the above is not there. So it makes it simple. The commonest type of pediatric cataract, and it's by a huge margin that it's the commonest type, and your time starts now. The green thing didn't come. Beep will come now. Green we have eliminated. answering also was by a huge margin. 41% of you thought it was the answer B. Since I have short-term memory, I have forgotten what B was. So B was lamellar cataract. Lamellar sounds very logical. Unfortunately, zonular cataract is the most common seen, not the one which is operated on. Lamellar is operated on, but zonular is the most common which is seen. People see it and forget it. Next. Retinal ganglion cell function can be tested by doing the color vision test or contrast sensitivity test or both the above or none of the above. Well, as I told you, whenever it is both the above or none of the above, it is usually both the above. But I mean, your choice. Time starts now. And it's equally distributed between both the above, none of the above. And the correct answer was option C, both the above. So as I told you, logically whenever I put this, go for both the above, most of the time you will be right. Next, fungal endogenous endophthalmitis is commonly caused by which organism? I'm telling you it's a fungus. So aspergillus, yeast, fusarium or mucor. Endogenous. I'm not talking about corneal. I wish I was. I'm a corneal surgeon. But the time starts now. So when you get endogenous endophthalmitis coming from within the body and it is fungus, which of these four fungi? Let us assume that all four are fungi. And you spread it across all the four, and the correct answer is option B, which is yeast. Yeast is the most rare fungus as far as the cornea is concerned. Almost 90% of the cases in the country are not yeast as far as cornea is concerned. But unfortunately, this yeast is the one which is from within and causes fungal endogenous endophthalmitis. Next. Which of these statements about ocular perfusion pressure or OPP is correct? OPP is the mean blood pressure minus the intraocular pressure, or it's the diastolic blood pressure minus the intraocular pressure, or it's the systolic blood pressure minus the intraocular pressure, or it's 2/3 of the mean blood pressure. Mean means systolic, diastolic divided by 2 minus the intraocular pressure. So this is at night when your nerve is being perfused. What is this OPP all about? Which of these statements is correct? How do scientists derive this OPP? And your time has started. And I'm glad that it's equally divided again so that the choices seem very logical. Or it was mini, mo. And the correct answer was D, which is 2/3 of the mean blood pressure minus the intraocular pressure. See, whenever you get some esoteric, abstract things like this, remember scientists always try and make it tougher. So instead of taking the systolic or the diastolic, which is easier, they make one more calculation. You have to go 2/3 of the mean and then minus. Next. And we have the 10th. Which ophthalmologist was chosen for a Nobel Prize but died before it could be given? And those rascals didn't give it posthumously. So was it Jules Gonin? Was it Hjalmar Schiotz, Karl Kohler or Walter Hess? So this was somebody who was not given the Nobel because unfortunately he died before the prize could be given. And the time starts now. Again, I took this from the IJO, and it's a mix that you've come out with, and the correct answer was Jules Gonin, who died unfortunately before the Nobel could be given to him. And can we have the leaderboard? Can we have the leaderboard of which numbers are doing well? Raman, is it possible? so these are, please understand that though you are not students, the computer G recognizes everyone as being a student here. So these are the people in the top 15 odd positions with out of 10 questions asked, they got 130 marks, which is more than 100%. How have you done this? You added the dummy marks as well. All these are tied with 130? I don't believe it's possible. There's something wrong, huh? No, but everyone, all these have got all right. Okay, we'll sort it out later. It just seems that everyone is doing phenomenally well. So poor Entod will have to give away more prizes. We'll go on to the next question. But everyone, the marks is 130. Okay, we go on to the next question. Louis Braille was blind. Take it as fact. Louis Braille was blind due to glaucoma, sympathetic ophthalmia, retinopathy of prematurity, or complications of congenital cataract surgery. What did he become blind due to? And your time starts now. Louis Braille. And we got it spread across. Nobody thought it was complications of cataract surgery. Very few people thought that. So it was sympathetic ophthalmia. It was a dreaded disease in those days. So he had an injury in one eye and sympathetic ophthalmia in the other. And that's how he was able to give us the Braille language. Next. The first US FDA approved toric foldable IOL was by which company? Johnson & Johnson, Alcon, Star Surgicals or Hoya. I have no financial interest in any of these. Only Entod is giving me money. And Entod has not made an IOL as yet. So the time starts now. US FDA approved toric foldable IOL. And most of you got that as B. And Alcon was so logical. Alcon was so logical. Even I would have gone for B. Luckily I didn't open my mouth. So the correct answer was Star, which is more known for its ICLs. Let's go to the next question. Which is true about Pertsch's retinopathy? The spelling of Pertscha. It results from blunt trauma to the eyeball. It's not associated with trauma, or it requires repeated anti-VEGF injections. Only one of these is true. That means the spelling of Pertscha is correct, or it results from blunt trauma to the eyeball, or it's not associated with trauma. And in descending order, the answers were A, B, C, and D. We could put a nice line graph there, and the correct answer is option A. The spelling of Pertscha is correct. Next, it doesn't have to be associated with trauma. You can get it without trauma. Yeah. So I'm in the way. Can people come in the front and sit down and occupy the seats? You can come on the stage as well. Everywhere, there's no problem. Please come in the front. Be more comfortable. And if I'm in the way, I'll come here. Yeah. Okay. Can we go on to the next slide?
Yeah, sure.
Put this on. answer this question, we'll wait. Yeah. Corneal sensations post-LASIK return to near normal in 2 years, 6 years, 2 months or 6 months. I normally tell my patients, 15 दिन में सब ठीक हो जाएगा. But in actual fact, which of these is correct? And your time starts now. 2 years, 6 years, 2 months or 6 months. I think 6 years sounds too much. And 2 months sounds too little. So it must be somewhere in between. I mean, my thought process. And many of you thought it was 6 months, and I think that is also quite logical. And the correct answer is B. Yes, it takes about 6 months for the sensations to return to near normal. So don't use a cotton swab and test before that time. And can we wait now, and can more people come and occupy the carpets in front and the red carpet over here? You will not be asked to walk the ramp. If you sit up, you can even occupy any of the seats here. Maximum you'll be asked to do if you've not won a prize is to give away the prizes. Anyone else wanting to come forward, please come. Okay, then we go on to the next question. What is false about FEVR? I just put the full form there, but it's too painful to read. So FEVR, it shows peripheral retinal non-perfusion. It presents at 1 year of age. It's a bilateral condition, has nothing to do with prematurity. So one of these is false. 3 of these are correct. Which is false, and your time starts now. I'm so happy that the quiz master's decision is final because I have no idea of the answer. And B and B are running neck and neck, but the correct answer is B. It presents at 1 year of age is false. The others were true. Let's go to the next. Which of these is not present in pigmentary glaucoma? Anterior bowing of the peripheral iris trans-illumination defects, 360 degrees clear pigmentation of 360 degrees pigmentation of trapped meshwork, or Krukenberg-Spendel on corneal endothelium. Which of these is not present? And your time starts now. And I think the answer is fairly obvious. Yes, I'm glad that all of you got that right. It's the posterior bowing in pigmentary glaucoma. If you take a B-scan, you get the classical posterior bowing of the iris, not an anterior bowing of the iris. And it was option A, anterior bowing, which was false. Next. Which of the following is true about chronic progressive external ophthalmoplegia? Chronic progressive external ophthalmoplegia. Diplopia is common, family history is absent, there's symmetrical ophthalmoplegia, and pupils are usually involved. Only one of these is true. And your time starts now. And it was divided between A and C, and the correct answer was C, that is symmetric ophthalmoplegia. Okay, so a lot of you did get that right. Next, according to the ONTT trial of optic neuritis treatment trial, which is about 20 years old, the IV pulse steroids improves the final visual outcomes, or it increases the rapidity of the vision return, or both the statements are true, or both the statements are false. So which of these is true? The optic neuritis treatment trial was a very landmark trial. Time starts now, where they gave pulsed IV methylprednisolone, and they did about 480 cases. and they discovered one of these and the logic says that it should be all the both the above, but let us see. It is option B, which is it just increases the rapidity of the vision return, but if you were to give placebo also, the final visual outcome remains the same. So both the statements are not true and both are not false. It does increase the rapidity of the vision return. Next. When would you label a patient as having acute retinal necrosis or ARN? If there are foci of necrosis with discrete borders around, or if there is a circumferential spread, or if there is a prominent inflammatory reaction both in the anterior chamber and in the vitreous, or all of the above. I would go for all of the above actually, because acute retinal necrosis सब कुछ खराब होता रहेगा. Let's go for the answer. The time starts now. Logic says all of the above, but it's your choice. Because retina very bad, I mean, necrosis terrible. Yeah, I'm glad you all went for all of the above. And the correct answer was all of the above. So that's what I said. I'm trying to help you that whenever there is something like this, go for all of the above. Most of the time, I'm trying to show off with my knowledge of in the first three, but the actual answer is all of the above just because I couldn't put a fourth point. Next. Sunflower cataract is associated with sunflowers. But if it is not associated with sunflowers, it is associated with ocular albinism or Wilson's disease or a glass blower's cataract exfoliation syndrome or juvenile rheumatoid arthritis. In which of these is a poet described it as sunflower cataract, somebody with a wild imagination? The time starts now. And so sunflower cataract has been typically described with only one of these entities. And almost all of you got that right, which is B. 80% of you got that right. Absolutely right. It's Wilson's disease in which it is typically described as a sunflower cataract. Next. Sorry, can we have the leaderboard? Can you go back? Okay, there's something wrong somewhere because everyone is showing the correct, all correct, and I don't believe that everyone in this hall, I have sold my questions only to 10 people. So you cannot have 17 people getting full marks. Huh.
These are the voting card numbers. And this is by default it's coming at the end of the all the questions.
Okay. So this mystery is solved. Don't look at the marks column. That is coming by default. So everybody's marks are showing as 100%. They will, depending on what amount you can send over to the red shirt people, across they will scratch out names and add names. So this marks will be changed by bribe levels. So this marks is default is wrong. Don't go by that. But the position is correct. So all those of you who recognize your ID numbers there feel good about it. Don't feel good about the marks because you don't have these many.
So 0465 is coming as a topper now.
Yeah. Yeah, the order is correct, the marks is wrong. Okay, fine. We go to the next question, 21. In WHO classification of vitamin A deficiency, they have got this peculiar classification. They've got X1A. X1A stands for bigot spots, for corneal xerosis, for corneal ulceration or keratomalacia or conjunctival xerosis. So it's a very specific thing. If the patient has this, then it's classified as X1A in vitamin A deficiency. And the time starts now. Of course, all these occur in vitamin A deficiency. That's why the WHO has got a range of classification, which is not Emery-Little classification. WHO classification. And amazing that all of you came out with 77% of you came out with D. I sincerely hope the correct answer is D. It is D. So conjunctival xerosis is what is X1A in the WHO classification. Amazing. Next. Lesions that appear dark on T1 images of in MRI. Now, there is something called T1 images and T2 images. So, we are talking about T1 images. Lesions that appear dark on T1 images, typically melanoma will appear dark or liposarcoma or both the above or none of the above. Again, logic says go for both the above, but let's see. Time starts now. Melano or lipo or both the above or none of the above. And none of you took my suggestion seriously of all of the above. So let's see. And the correct answer was none of the above, yeah, okay. So all the above was wrong, sorry, none of the above. So if you don't like both of the above, then go for none of the above. Let's go to the next question. During accommodation, the eye also undergoes choroidal thinning or choroidal thickening or a decrease in axial length or none of the above. During accommodation, does the eye actually change or none of the above? I mean, chota thing like accommodation, I don't think it does too much. So I would have gone for none of the above, but let's start the timer. And you're looking at your mobile phone and suddenly your choroid thickens or thins, doesn't sound very logical to me. And you went with my suggestion of none of the above, so let's assume that no changes take place, and the correct answer, unfortunately, is choroidal thinning. What a terrible thing for the choroid to do. Just when you're looking at a mobile phone and your favorite porn clip, the choroid decides to thin. Next. What about malignant melanoma of the choroid? Which of these is false? The thickness is usually greater than 2 millimeters. It often shows breaks in the Brooks membrane. SRF is lacking, and it shows congested blood vessels at the apex of the tumor. So one of these is false. They all seem very true to me. Your time starts now. And it's, again, many of you gone for C and D, and the correct answer, which is false, is C. SRF is lacking. Okay, so much of tumor, thoda bahut to fluid kidhar to bhi ghus jayega, na? Next. The affected pupil is dilated in AR pupils, Aios pupil, Horner's syndrome, or none of the above. The affected pupil, suppose you got a right-sided Horner's syndrome or Aios, in that, would the affected pupil be the dilated pupil or none of the above? If you are confused, go for none of the above. Timer. Even they start thinking about it, so you got extra time. Aios pupil, Horner's pupil, Argyll-Robertson pupil. And most of you got that, 52% of you got that as B, and the correct answer is B, Aios pupil. So Aios pupil. Next, the F in Kaiser-Fleischer ring in Wilson's disease stands for Fletcher or Fleischer or Fleischer.
So you are checking spellings actually here, whether they know the correct spelling or not.
Absolutely. I was tempted to ask for Kaiser spelling, but I thought this might be more interesting. Kesar, Flesher, Rin. What is the Flesher? Which of these is Flesher? Your time starts now. I'm sure Americans would have made it nice and sweet and put the A option. But we are not in. And most of you got that correct. 86% of you got that right. And the correct answer is B, Fleischer. Okay, so whenever I comes before E most times, except in the quiz questions, when E comes before I. Which bug is oomocyte and is also called a parafungus? Is it Pythium? Is it Acanthamoeba? Is it Mycobacterium chelone? Microsporidium. One of these is a parafungus because it has some properties like a fungus, but it's not a fungus. And it's also technically called an oomycete. Oomycete. Oomycete? Oh my God type of thing. OMG, but this is OMC. Your time starts now, but you time chalu karo. So one bug is referred to as a parafungus, and you can even call it an OMC. And many of you thought it was Pythium, and Computer G will tell us it is indeed Pythium. So Pythium is the one which is referred to as a parafungus. And we go on to the next. Which of the following is not raised in sarcoidosis? KL6 mucin levels, serum soluble, spelling of soluble to be ignored, IL-2 receptor levels, serum lymphocyte count, and ratio of CD4 to CD8. One of these is not raised in sarcoidosis. Stands to reason that the other three are raised. So when it's not raised, the CD4 by CD8 is not raised, then your suspicion goes up because sarcoidosis is a disease of elimination. And the correct answer, of course, was serum lymphocyte count. So serum lymphocyte count is not raised. CD4 to CD8 was so logical, even I thought it was the correct answer, but it's a lymphocyte count. So sarcoidosis is a process of elimination. It's very difficult to diagnose it per se because it limits so many things. But if the serum lymphocyte levels are normal, then you think it could be sarcoid if everything else fits in. And for the last question from my side, before Dr. Namrata gives you pictures and nice easy visuals to see. Next question. Atropine drops for myopia control. Now this is an Entod thing.
This had to be there.
This had to be there. So penultimate question. Atropine drops for myopia control currently in our country are available as 0.1%, 0.01%, 0.05% or 0.5%. Okay, the time starts now.
This should be 100% correct.
I hope so. Otherwise
Entod is going to feel bad about it.
They will alter the results. They are already doing some mischief there. So currently they are available only as 0.01% drops. They will shortly come out as a higher strength as well. 0.01% is what is available in our country. It will double in strength. It will become stronger in due course. It's in the pipeline. But currently option B is the only one available to us. Next and the last question. Lifitegrast eye drops. Lifitegrast eye drops not available in our country are used to treat dry eye, glaucoma, bacterial keratitis or fungal keratitis. Lifitegrast eye drops. They were first made in Japan. They've been used extensively for over 5 years now in Japan. And they were Nobody spends money on fungal keratitis. Very few spend on bacterial with no result because no fluoroquinolone new ones are coming out since last 10, 15 years. So every research is on dry eye products. So lifitegrast is used to treat dry eye and hopefully it will soon be available in our country as well. Thank you so much. With that, I hand over the mic to Dr. Namrata for the next series of 20 questions.
Can we have the next question, please? So all are true of ketoplast, except autologous pericranial graft, allogenic dehydrated human pericardium patch graft, used for management of orbital implant exposure. Gamma irradiation is used for sterilization process. It's except. So 3 things are correct and 1 is wrong. So 43.4% have said it is A and the answer is? It's a mixed response. So the answer is A, autologous pericranial graft. This is false, all the other 3 things are true. So can we come to the next slide, please? So the question is picked up from here. It is a dehydrated human pericardium patch graft ketoplast, used for orbital implant exposure. Can we go to the next one, please? All of the following are true about repressible hydrochloride hydrate, except 0.4% ophthalmic solution lowers IOP by increasing conventional aqueous outflow through the trabecular mesorectal lens canal, leads to severe and persistent form of conjunctival hyperemia requiring discontinuation of the drug, and systemic adverse events are minimal. And your time starts now. So repressible is a drug which is being used. No, I will not tell you. You should know it because that will give the answer. So 47.8% have said C, and the answer is indeed C. Next slide, please. Repressible is a Rho kinase inhibitor, lowers the IOP by conventional aqueous outflow. Conjunctival hyperemia is the most common adverse event, but it is usually transient and it is mild. So can we go to the next question, please? All of the following are true of orbital apex syndrome. This is very simple, I think, except decreased vision, diplopia, and restriction of eye movements are the common presenting complaints. Involves 5th, 6th, 7th cranial nerves. Can be seen in association with metastatic lung carcinomas, and MRI is the preferred diagnostic method for evaluating patients with orbital apex syndrome. So 61% have said B, and the answer is indeed B, involves 5th, 6th, 7th cranial nerve. Next slide, please. So it involves the following nerves: 2, 3, 4, 5, 6. Easy to remember, 2, 3, 4, 5, 6. Can we go to the next slide, please? All of the following are true of lifitegrast, except it is a 5% ophthalmic solution approved by FDA in 2016 as a new drug for the treatment of dry eye disease, causes strong inhibition of T-cell adhesion to ICON-1 expressing surfaces, is water insoluble in nature. So your time starts now. A lot of theory in this question. So 55, half of you have said that the answer is D, and the answer is indeed D. Next. So this is lifitegrast, and it is highly soluble in aqueous media. So next question. All of the following are true of preserved flow ab externo microshunt except is composed of biologically active polypropylene material, 8.5 millimeter long device with an internal lumen of 70 microns, indicated for lowering IOP in order to decrease risk of progressive glaucoma and associated irreversible vision loss. FDA approval is still awaited. How many of you have heard about it? Anyway, your answer will tell how many of you have heard about it. You are busy answering. So almost 60% say the answer is D and the answer is A. That was a good news, isn't it? So this is what is preserved flow ab externo microshunt. I don't have any financial or proprietary interest, just to quiz you and to dodge you, that's all. So we come to the next question, please. Phenochrome plus. Now I think you have to, this should be 100% correct for everybody. Phenochrome plus injection consists of the following combination of components. Lidocaine 1% with phenylephrine 0.3% plus tropicamide 0.05%. Lidocaine 1% plus phenylephrine 0.3%, tropicamide 0.02%. Lidocaine 0.5% plus phenylephrine 0.3% plus tropicamide 0.02%. Or lidocaine 1% plus phenylephrine 0.3% plus tropicamide 0.2%. I hope none of the signboards of Entod have written the answer. So there are no signboards inside the hall and the answer is what a mixed response. Entod will withdraw its sponsorship from the quiz. Anyway, so the answer is B. Can we go to the slide before that? Can we go to the slide before that? Next slide. Okay, next slide. Okay, so that bar is gone. Anyway, the answer is B. Where are we? So the answer is B, tropicamide 0.02, phenylephrine 0.3 and lidocaine 1%. So it is TPL. I think everybody knows Dr. T.P. Lani, TPL. And the way to remember is 0.02, 0.3 and 1. So another way to remember is lidocaine I looks like 1, phenylephrine E looks like 0.3 and tropicamide P looks like 2. So that is another way of remembering it. Anyway, I think Entod should be happy. I have made them, I've, shown them how to mug it up. Okay, we come to the next question. All of the following are true of Kozabak-Merritt phenomenon except a life-threatening thrombocytopenic coagulopathy causes severe thrombocytopenia and hypofibrinogenemia associated with vascular tumors such as caposiform hemangiendothelioma and tufted angiomas. Hypercoagulable state results from vessel wall abnormalities with secondary abnormal blood flow causing turbulence and increased clotting tendency. And your time starts now. Too much of theory, too much of turbulence. So 40% of you have said B, and the answer is indeed B. Was that a wild guess? You knew it. Okay, good. Okay, I think we can go to the next question. Choose the right stain used to identify deposits caused by the shown corneal dystrophy. Alcin blue, pass, hematoxylin, leucine, trichrome. I think this is fairly simple. Time. So half of you got it correct, the other half haven't, and the answer is B. Should we come to the next question? Alright, this is just to show Mason Tricom and pass. Vedismo, a recently approved FDA drug, is composed of which of the following VEGF inhibitor? Ranibizumab, faricimab, bevacizumab, and aflibercept. And your time starts now. Timer? So, I think most of you know, it's 65.6% have said B, and the answer is B. So it is faricimab. Okay, next. All of the following are true of fourth cranial nerve associated palsy except. It has the longest intracranial course of the nerves, which makes it vulnerable to damage with relatively mild trauma. Bilateral palsy causes a chin down posture, while unilateral involvement causes contralateral head tilt. Clinical signs include hypotropia and cyclotorsion. Worsening of diplopia occurs while visualizing objects in the primary position. Again, I think this is a fairly simple question which all the postgraduates should be able to answer. This was unexpected. Anyway, the answer is C. Okay, we move to the next question. In the surgical procedure RB-PDAC, excitation of rose Bengal dye occurs at which of the following range of wavelength? 450 to 500, 500 to 550, 550 to 600 nanometer, or 600 to 650 nanometer? And again, it's mixed kind of a response with one-third going with B and the other one-third going with C. I think this happens when numbers are there, because sometimes you can get very close to two of the numbers. Can we have the answer, please? The answer is B, 500 to 550. So Rose Bengal photodynamic antimicrobial therapy is a new treatment for resistant Fusarium keratitis and is coming into vogue. So next question, please. All of the following are true about the clinical entity shown in the photograph except congenital malformation of the optic nerve caused by a defect in the closure of fetal fissure. More common in males. Associated clinical features include dysmorphic facial features. And the timer, please. The timer is not ticking. Okay, 40% of you have said C, and the answer is C. Okay, next slide. So these are the features of morning glory syndrome. I think again this is a fairly simple answer. Simple question. What of the following is wrong about LipiFlow treatment? FDA approved treatment for meibomian gland dysfunction treats MGD by warming and massaging the inside of the eyelids to restore healthy oil production and improve tear quality. Thermal pulsation system helps to relieve blockage of the eyelid glands, delivers heat to the inner eyelid at a temperature of 20 to 25 degrees centigrade. So 67.6% I think have said that D is the answer, and the answer is indeed D. So that again was a fairly simple question. We come to the next one. What of the following is wrong statement about the lateral orbital wall? I think again this is a simple question. Strongest wall of the orbit separates orbit from middle cranial and temporal fossa, is composed of zygomatic bone and lesser wing of sphenoid. Superior orbital fissure is present between the greater and the lesser wing of sphenoid bone. And the timer, please. So 44.98% have said C, and the answer is indeed C. So next slide. You can move to the next slide. All except one are the recommended guidelines for screening of ROP except. Screening should be performed in all preterm neonates who are born less than 34 weeks gestation and or less than 2,000 grams birth weight. The first treatment examination to be performed is no later than 4 weeks of age or 30 days of life in infants born more than or equal to 28 weeks of gestational age. Infants born less than 28 weeks of less than 1,200 grams birth weight should be screened early by 2 to 3 weeks of age to enable early identification of ROP. A follow-up examination should continue until complete vascularization or regressing ROP is documented. You currently have the timer. So the timer starts ticking from 10. Huh? Yeah. Okay. That was unexpected actually. So the answer is A. So the answer is A, and we come to the next question. Which of the following is wrongly described? Galileo G4 dual Schemflick camera with placebo disc, Cirrus Schemflick camera with scanning slit technology, Opscan 2 scanning slit technology with placebo disc, Pentacam rotating Schemflick camera. I think this is again fairly simple. So fine. Okay, so most people have said the answer is B, and the answer is B indeed. Okay, next slide please. All are true about Zeiss Visumax 800 platform except offers reduced laser time in comparison to its predecessors, has a laser pulse repetition rate of 0.5 megahertz. The central line assistant system allows for easy centration. The oculine pattern allows for cyclotorsion alignment. And the timer please. This is a purely corporate question with no proprietary interest or financial interest at all. And so I'm happy and glad that 56.15% have answered B. I never expected actually. And can we have the next slide please? B. So the answer is B. So, okay, we can skip it because otherwise we won't complete on time. All are true about posaconazole except. So one antifungal will definitely be there, especially when I am doing the quiz. Used for the management of recalcitrant fungal keratitis, structural analog of itraconazole, acts by binding to ergosterol and altering the cellular permeability, has an in vitro activity against both yeasts as well as filamentous fungi, including agents of mucormycosis. Okay, so there is a clash between B and C, and the answer is C. So whenever there is a clash, no, from the other group, there's a like that. That thing comes when the answer flashes. Okay. All right, we can leave this. All of the following are part of typical clinical triad of Chisak syndrome, except acute multiple encephalopathies, branch retinal artery occlusion, branch retinal artery vein occlusion, sensory neural hearing loss. Except. Okay, so more than half of you have said C, and the answer is indeed C. We come to the next question. This is the last question. All except one are the features of disorder associated with TRPM1 gene mutation. The disorder involves defect in signal processing within the cone photoreceptors, usually presents with myopia from birth. Color vision abnormalities can be seen in some patients, and some forms of the disease may have normal fundus picture. Can we have the timer? Okay, so 40% have said B, and the answer is A.
Some of these questions were many more questions. Some of them were unpronounceable also. I thank all of you who participated, and we will now have the leaderboard with the marks corrected presumably. And your voting pads, there are two things with the voting pad. They have the numbers, ID numbers. The marks are not displayed still. No, this is all 530. This is wrong. 50 questions, 530 marks. Everyone got that. So the marks are not correctly displayed, but the leaderboard is correct. So can we have, can we have the leaderboard shown?
Yeah, they're doing.
That's what they're doing. So the marks is totally incorrect. This is only the fastest finger type of thing. But we want to know the marks that everyone has got.
So
we need to know the marks that everyone has got. Please stay back for a couple of minutes. ID number, yeah.
So it will take, I'm told it will take just 2 minutes. So be patient.
In the meantime, you are not allowed to ask any questions to the quiz master. Only quiz masters can ask questions to you. It will be a pity if you've left and you won, because then your voting pad will have been surrendered. All surrendered voting pads become property of quiz master, so he gets the prize. Don't leave with the voting pads, because there is a penalty for that as well. The pads have to be returned. So if you leave, please give the voting pads back.
So all those who are hopeful are here in the hall.
Yes.
And all those who know that
Yes.
more than 2 wrongs
Yeah.
have already left. I actually quite a large number expecting to win, isn't it?
Yeah. Otherwise, we'll simply have a re-quiz and ask the same questions again. We've forgotten the answers in any case. Senior most, absolutely. Senior most student who is present in the hall still. Raman, there are small possibilities that we'll get the answers. Yeah. Downloading.
What happened? Do you already know the result?
Tell us the election
Please
result
tell us
also.
the result in case you know, Nikita.
Tell us the election result also. 4 o'clock we'll know that.
So Nikita, Ashish, you already know the result? What did you do? You lost it? क्या है भाई? Raman, are you having it? What, speed is not good for downloading? It has to download only the numbers, no? What is downloading?
Can we have the leaderboard? At least we'll ask them to stay. The march can come, but the leaderboard. So request those with ID numbers 300, 465, 28, 251, 429, 369, 72. All of you please come up on stage.
No, they are fastest. The time is coming. It says nothing.
Yeah, but these are the actual toppers. The marks will come. Is that right?
No. No, this is just fastest finger. This is just time across the ID numbers. That's all.
Cancel. Don't come up. Computer failed. The master computer failed. I don't know what the technical issue is. The technical problem. Can't take this much time. It's your election भी गड़बड़ कर दोगे तुम.
Still downloading. 5 more minutes. Okay. As far as we don't impinge on the other people's time, it is okay. What is downloading? What is so heavy which is taking 5 minutes to download?
गलती से मिस्टेक हो गया. गलती से मिस्टेक हो गया इनसे एंटोड वालों से.
Has it downloaded? Okay. So Entod had decided to felicitate us before opening the results. Whatever the result, let us at least get felicitated for the quiz.
Let's have a round of applause for the quiz masters.
Take this opportunity to thank Entod. They put in a tremendous amount of hard work to get this quiz together and to get all of you with the voting pads in the hall, and it's a technical snafu which can happen at any time to anyone. It's also the richest of the 3 quizzes that took place in the AIOC.
So I put a slide there so that you
Yes.
will continue to stay here.
Yes, so it is the richest quiz. There was one quiz by the ARC on day 0, Wednesday, and then yesterday we had another quiz, and this is the actual mega quiz by Entod and AIOC. And I thank the Masurkar family for supporting us for the last, I think, 2 or 3 years that they've been with us for this quiz. To prevent the trembling fingers of the technical staff, because there's 2 people working and 27 people observing him and waiting for him to finish, we'll have the results at the Entod stall. So we won't announce the results now. So the good thing is that even if you are sitting next to each other, the Entod stall people don't know. So you will still get prizes accordingly. So we'll please drop into the Entod stall after lunch, and the results will be displayed, and of course it will be put up in the official AIOS website, etc., etc. we just say technical issues, technical people, they got the keypad numbers, no? So you just, but if they return the keypad numbers, how will they know it is? And वापस return नहीं करेंगे तो तुम्हारा loss of keypads. No, but if I say that I will come to an Entod stall and read that 119 is the winner, and I will say I was 119. Is registered. You have registered everybody. Name, mobile number, everything is registered. Okay. So then they can return the keypads. So you can return your keypads. They've got some tracking system like the government has with Aadhaar. Wonderful idea. Take a photo of your keypad or take a photo of your neighbor if you think the neighbor was better than you. Then we'll have a dispute in Mumbai courts. And return the keypads on your way out. Thank you so much for being so patient. Thank you.
We apologize for the technical problem, but I would request everybody to take the photograph along with your iCard, the registration card. So that will be better that you are the person along with the holding of your voting pad. So please cooperate and thank you very much and sorry for the trouble. Entod stall is 29 and 30, so you can come there and show the picture. After 3 o'clock? 3 o'clock, after 3 o'clock that would be fine, right? After 3 o'clock, stall number